$3.5 million in the budget is for recruitment and retention initiatives and specifically targeting family doctors working in rural areas. Data shows there were 235 doctors practicing in rural areas at the end of last March, a decrease of 8 physicians, or about 3% from the previous year. There were 43 fewer doctors working in Regina and Saskatoon in the same period. That means patients are waiting longer for care, and doctors are feeling more pressure.
We've always had problems with retention.
This health policy consultant says COVID-19 has made these problems worse.
How's the pandemic management been? Dismal compared to other provinces. How influential have healthcare workers been in charting the course of the pandemic and being listened to?
The nurses union says frontline nurses need to be given adequate practice time and support, or the job is just not worth the stress, especially in remote and rural areas where they can end up in very overwhelming situations.
They were finding themselves in charge of very busy, small emergency rooms and inpatients, and they were scared to death because they did not feel that they had the experience.
The government is also increasing spending by $1.5 million to bring 300 healthcare workers from the Philippines to Saskatchewan over the next 2 years. But another union says the government should also be working on recruiting from Indigenous communities.
We have a ready and willing workforce here that is, made in Saskatchewan. And I think that those conversations are long overdue with the leadership of First Nations.
There's also plans for a new agency to support recruitment and retention efforts. The Ministry of Health says the goal is for it to be operational in the fall. Yasmin Ranea, CBC News, Saskatoon.